I am Dr. Toku Takahashi. After specializing in gastrointestinal surgery in Japan for 10 years, I moved to the United States. I worked for a total of 20 years at the University of Michigan, Duke University, and the Medical College of Wisconsin. About 10 years ago, I returned to Japan, and I am currently running an integrative medicine clinic in Nagoya. Previously, I spoke about love and health. This is now the third talk in that series. Last time, I discussed animal experiments in which oxytocin levels increased when rats took care of their peers. I also explained that, in addition to sensory stimulation and passive psychological stimuli, active empathy toward others is a powerful factor that stimulates oxytocin secretion. I explained that these factors are effective in activating oxytocin. However, these findings were based on animal experiments. This naturally raises an important question. Does cultivating compassion in humans actually stimulate oxytocin secretion? There is a form of meditation known as altruistic and gratitude meditation, in which one continuously expresses gratitude toward others and sincerely prays for their happiness. We measured salivary oxytocin levels before and after this meditation. This shows oxytocin levels before meditation, and this shows the levels after 1 hour of altruistic and gratitude meditation. When comparing the before and after measurements, it is clear that oxytocin concentrations increased after meditation. We summarized these findings and published them in an English language journal 7 years ago. This paper became the world's first report demonstrating that altruistic and gratitude meditation promotes oxytocin release. In Tibet and parts of Nepal, there has long been a form of meditation known as compassion meditation. May all living beings be happy. May all living beings be free from suffering and distress. May the wishes of all living beings be fulfilled. May the light of enlightenment appear in all living beings. May those who dislike me be happy. May those who dislike me be free from suffering and distress. May the wishes of those who dislike me be fulfilled. May the light of enlightenment appear in those who dislike me as well. In this way, setting aside one's own happiness and devoting oneself entirely to praying for the happiness of others. Such prayer-based meditation has been passed down continuously in parts of Asia. As American psychologists adapted this compassion meditation and established a meditation method called loving kindness meditation, SKM, about over 20 years ago. An important point of LKM is that it is not necessary to actually meet people or perform kind actions in person, whether they are loved ones or people you dislike. Instead, practitioners train themselves to sincerely and wholeheartedly wish for the happiness of all people without discrimination. Subsequently, reports from the United States demonstrated that LKM is effective for chronic pain and also reduces anger and anxiety. Furthermore, studies using functional MRI to examine brain activity before and after LKM practice revealed significant changes in brain function. In summary, compassion meditation, which had long been transmitted within Buddhism, was reformulated by American psychologists as a new meditation method. Loving kindness meditation, LKM, and taught to patients. Its effects were clinically evaluated and scientifically demonstrated using advanced brain imaging techniques such as functional MRI. This represents a remarkable fusion of Eastern philosophy and Western medicine. This is a well-known quote from His Holiness, the 14th Dalai Lama. If you want others to be happy, practice compassion. If you want yourself to be happy, practice compassion. It is not enough to practice compassion just once or twice. Compared to yesterday, cultivate more compassion today. Compared to today, cultivate even more tomorrow. Train yourself to continuously deepen your compassion for others. The Dalai Lama teaches that such training is the best way for both oneself and others to become happy. From the perspective of oxytocin physiology, cultivating compassion toward others leads to increased oxytocin release from the hypothalamus. This oxytocin contributes to maintaining physical health and can be interpreted as a mechanism through which one's own happiness is enhanced. Please look forward to the next session.